what treatments are available for ear infections and hearing loss. That is really dependent on the cause of the hearing loss. With ear infections, it depends on how frequent and exactly what type of ear infection. I think that patients will often hear the term ear infection and get the sense that refers to one thing, but it can refer to many things. Within the ear, there are external infections, sometimes referred to as swimmer's ear, and that type of infection can be caused by bacteria or a fungal infection or a viral infection. And that can cause a mild infection or a recurrent infection. Sometimes treatment is very simple and it involves watching and waiting. Sometimes that type of infection requires antibiotics or steroids, and occasionally it also requires surgery. For example, if you have a middle ear effusion, which is what you often hear referred to as fluid. Fluid can remain in the middle ear space after an acute infection, and patients can't hear. With regard to hearing loss, again, for a lot of us, hearing loss occurs due to aging, and it may occur due to a history of noise exposure, occupational noise exposure, for example. And so sometimes hearing aids are appropriate, but not always. There are conditions where, as I mentioned, sometimes fluid is a problem, which can be a treatable source of hearing loss.